The Kenya Bureau of Standards has categorized the types of face masks being manufactured in the country into three. These are the surgical masks, particle masks, and reusable cloth coverings. The public has been advised to leave the surgical masks to healthcare workers and patients, but KEBS acknowledges that the particle and reusable cloth masks provide limited protection against COVID-19 droplets, noting that there are no Kenyan standards for reusable cloth masks. Certification is not mandatory prior to sale. Here's why it is imperative you wear a mask before you venture out of your home. We've been told over and over that the best way to protect yourself from the novel coronavirus is to keep a distance of 2 meters or 2 arms lengths between yourself and others. But new research coming out of the Massachusetts Institute of Technology, and that is MIT, shows that the virus can travel up to 8 meters in a sneeze, 6 meters in a cough, and an act as innocuous as exhalation can spread the virus. In other words, breathe wrong and you spread the virus. This is on top of what we already know, which is that the virus can stay suspended in the air for 3 hours. Given that short of death, we cannot stop breathing, the World Health Organization is reevaluating its position on masks, and the Kenyan government has not been left behind.
If you are getting into a matatu, you are advised to wear a mask. If you are going to ride a tuk-tuk, you are advised to wear a mask. Beginning today, we have begun local production of the face masks.
Given this new information that the virus travels much farther than initially thought and can remain viable on surfaces for days, we've been forced to change tact and quickly.
It is a measure that is better done than not done.
Another reason why WHO and governments were hesitant about promoting the use of cloth masks is because they were thought to provide little, if any, protection from particle penetration. But if done properly, the Indian government says it's only 30% less effective than the surgical mask. And if nothing else, the MIT study shows that a mask can deflect the virus, denying it easy access to your mucous membranes. That's your eyes, your nose, and your mouth. So what does it mean? It means washing your hands or sanitizing them properly before you put your mask on. You must ensure that it covers your nose and mouth properly, and that there are no gaps even on the sides of your face. Now, do not turn your mask inside out to reuse it, which means do not be cheap. And also, do not touch your face even with the mask on. And that includes, let me just put it on properly again. And that includes this, to either eat or smoke, then putting it on again, because you're simply transferring the virus onto your hands. It also means you should not reuse a disposable mask. And the minute your mask gets damp, you must take it off, as its effectiveness is greatly reduced. And to take it off, do not touch the face of the mask, but use the strings.